Hello, I'm Kennedy.
And I'm Bailey.
Welcome to our Radar Career Review. Welcome everyone to this exciting career-based interview with Kathryn Harvey. She's a dual board certified family practice and pediatric nurse. She attended undergraduate and graduate school at the University of Illinois, received 2 master's degrees in nursing and public health.
She has worked in a wide variety of settings, including intensive care and the emergency department. Currently, she is serving her patients in a telehealth urgent care setting. She has been an RN for 30 years and a nurse practitioner for 25. Her specialty areas include minor surgical procedures and urgent and emergent care of all people throughout their lifespan, from infancy to elder care.
Every day, Kathryn welcomes the challenges of her career. Today, we have the privilege of interviewing her.
We'll hear all about her journey so far and what she has planned for the future.
Before we start, I would like to thank you for joining us.
Thank you for having me.
Thank you for joining us. Can you share your educational journey, including the steps you took to become a nurse?
I went to the University of Illinois at Chicago for my undergraduate degree, where I finished my Bachelor of Science in Nursing in 4 years. And I worked for 3 years in the intensive care unit. After that, at the University of Chicago hospitals, taking care of pediatric and transplant patients. And I decided I wanted to go back to graduate school, so I earned my dual master's degree in nursing and public health.
Were there any specific experiences or influence that led you to pursuing your career in nursing?
Yes, when I was young, my Aunt Ruth, she was a nurse, and she was about 80 years old when I was really young. So she used to tell me really glamorous stories about being a nurse and how there would be a big snowstorm up in Illinois and she would be the only one at the hospital and have to deliver 3 babies because the doctor couldn't make it there. And I knew when I heard those fun stories that this is what I wanted to do with my life.
What motivated you to become a healthcare provider, specifically choosing the path of nursing?
I've always been a helper, and I love helping people, and I love my patients. I love watching them get better, and I love helping them through their worst moments. And I knew from a really young age that this is just the only career path for me.
Are there any particular aspects of nursing that are uniquely fulfilling?
When I see a patient who is really, really sick get better, that's always really super gratifying. And I had a patient last week that called me and told me I saved her life because she was having horrible abdominal pain, and I sent her to the emergency room and she didn't want to go. She was arguing with me, but I told her, you have to go, things aren't right. And she called me a few days later to tell me that I saved her life.
Can you provide insight into your daily responsibilities as a nurse?
My daily responsibilities include, before my shift starts, I usually go over my patient list. I have patients scheduled on my list, and I like to review their charts and, to refresh my memory. Have I seen this patient before? Do I know this person? And, to help me think ahead about what this person might need. Then throughout my day, I see my scheduled appointments, and I take care of each person according to their needs. Right now it's flu season, and COVID is up 41% in the last month. So I see a lot of flu and COVID patients, and I treat them with medication. And I help them to understand and educate them on what's going on, what the process of the illness will be, and advise them to take medicines to help with their symptoms.
What are some of the common tasks and challenges you face?
Well, I have a lot of patients who like to read about their diagnosis on Google, and then they like to get on the phone with me and argue with me about it. And it's very difficult sometimes to explain, I don't think what you read is correct, and what you read on Google does not supersede my medical judgment. And I do have patients that have a lot of mental illness, such as depression, anxiety, and most of the time when I see them, they're crying, they're very upset, they're anxious, and it's a challenge of my communication skills to be able to help them in that moment, with what they need and how I can best serve this person in this moment in time.
Why did you decide to become a nurse instead of pursuing a different healthcare profession?
Well, I mentioned my aunt earlier in the interview, and she really motivated me to do this. I think that I would be good in any role in healthcare. I think I could become a physician, or I could do physical therapy or any of that, but I think this is really where my passion lies.
Are there any personal values or experiences that align with your nursing profession?
There are. I'm a Christian, and I like to use my Christian values in the care of my patients. I like to be honest and straightforward, and I like to be encouraging and uplifting, and I like to be able to use my abilities to get them to be their best health.
Nursing is a diverse field. Can you discuss the variety of roles that nurses can take on beyond the traditional hospital setting?
Oh, that's a great question. One of the things I love about nursing is there are so many different areas that one can participate in, you know, from a young nurse to being an older nurse. Outpatient has been my path for the last 5 years. I've done public health through the health department, where we do public health surveillance, such as if a person had an infectious illness like E. coli that they got from eating at a restaurant. Public health nurses will go through the steps to find out those patients who were ill and how they were treated and to trace back the source. So that's puzzle solving. I like working in the outpatient area. Urgent care in the last 10 years has been huge. And, you know, clinics, mental health clinics, and telehealth that I work in now is very rewarding. I like it because I can work from home, and I can, you know, I don't have to worry about catching infectious illnesses that my patients have, which in the past has been a big problem for me. Catching COVID, flu, strep throat, and all that is not so fun. But when you work from home, it's great that they don't cough in your face.
Are there specific areas of nursing that you find particularly interesting or rewarding?
I like taking care of patients with poor mental health. Usually in my arena, it's anxiety and depression. And I like when I start them on a medication, usually when I first see a patient, you know, they're sad, they're crying, they're in trouble, or they're going through a horrible life event like a divorce or criminal charges, that sort of thing. And I usually refer them to a therapist to talk about their feelings, and I may start them on medication to help them with their feelings. And when I start a patient on medication, and then when I see them a month or two later to follow up with them, they usually look like a whole new person. They go from sad and crying to looking much more happy and alert and responsive. And to me, that's so rewarding to know that I helped that patient through a very difficult time.
Nursing often involves collaboration with other healthcare professionals. How do you work with doctors, counselors, and other staff to provide comprehensive care?
Well, in my role as a nurse practitioner, I refer patients to, you know, physicians or psychiatrists or therapists or specialists such as a cardiologist or a nephrologist, which is a kidney specialist. And it is my job to confer with the specialist on their findings and to help the patient follow up with those findings and help them to adjust medications or, you know, interpret test results.
How do you stay current with advancements in healthcare and nursing practices?
Oh, I spend a lot of time reading. I read journals and I attend continuing education courses, not so much in person these days. It used to be more in person, but now they're online courses. So if I have an area that I find particularly interesting, I sign up for an online course. Such as recently, I took a course on something called Suboxone, which helps people with heroin and opioid addictions to help keep their symptoms of withdrawal at bay. And I found that course very, very interesting.
Are there any opportunities for professional development that you find particularly beneficial in your career?
In nursing, there's always an opportunity for advancement and education. There's journals, you can take classes. I have the option to complete my PhD in nursing, which I'm considering. It's, with my children, it's a little difficult at this point, but I think at some point I'm going to go back to school and get my PhD. But for any topic that a nurse is interested in, communication, any health issues, medications, there's always some sort of education available. And usually they're paid for by the company, so it's very easy to achieve more education and attend courses.
Is there anything else you would like to share with our middle school students who are watching this interview?
I think being a nurse is an honor. And there are a lot of nurses, older nurses like me, who are aging out of nursing, and we need young folks to come into the profession. It's not always glamorous, and it's certainly not easy, but it's very worthwhile. And I would encourage any young man or lady or to become a nurse, if you feel the way that I feel about my career. I'm Kathryn Harvey, and you are watching Raider Media News.